Welcome, Antonio. Tell us about yourselves.
Hi, thank you, Matt, for having me here. I'm Dr. Antonio Romero Rubio. I'm a medical doctor from Mexico, currently living in Geneva as a global health advisor at the Permanent Mission of Mexico to the UN Geneva. I have a master's in health policy planning and financing by the London School of Hygiene and Tropical Medicine and the London School of Economics, and I'm a passionate of global health.
How did you get interested in global health?
So when I was a medical student, I participated in a medical students association in my school, which I co-founded with some of my colleagues. We realized that there was opportunity to engage with medical students, not only in our city, but throughout the country and throughout the world. So we decided to bring this experience to our colleagues, and we're starting to become part of the Mexican Association of Medical Students and the International Federation of Medical Students Associations, IFMSA. And then since then, I started to getting involved in what does IFMSA does at the national level with the MEF or at the international level. And then I started participating in, let's say, the working groups, the advocacy projects. And then I realized that was something that interested me. And I decided to start engaging in high-level meetings. So I attended the high-level political forum for sustainable development goals in New York at the UN headquarters. Not as part of IFMSA, as part of another organization, but that's when I get to see what was the global health in practice when we address the Sustainable Development Goal 3, which is about health and well-being. And then I continue engaging. I start growing at the regional level. I hold a position there. And then I came to Geneva, to the World Health Assembly. And yeah, I got in love on what it's done in the World Health Organization. And yeah, I decided to seek a career there in global health. So that's how I got to experience global health since I was a medical student.
That sounds like an amazing journey. And what I'm hearing there is, so there was an interest that you had, and then you got involved in various societies, and then being involved with the various societies, that then opened doors, and then one thing led to another. Is that correct? Yeah.
Yeah, that's correct.
Yeah. And then you educated yourself, and you looked for relevant career opportunities that then ultimately, when you applied for the job that you have now, is you then had the track record of societies which led to experiences, as well as a track record of education that then enabled you to get the job that you have now.
Yeah, that's correct. So yeah, so I didn't know what was global health until I started engaging in this organization, and I starting to hear the concept and what is that, how it's public health, global health related, and what and how can you seek a career in that. At the beginning of my career, I wanted to be a plastic surgeon, and then I changed paths because of these organizations. And it was on my very last year of medical school that I realized that I wanted to seek a career in global health / public health. So I was like, why not? And then I started applying to master's degree. And the first year I didn't got in, so I started working in my school and keep going these projects. That's the year when I came to the World Health Assembly, and then I got the opportunity to get a scholarship to go to the UK and study my master's there, and that led me to where I am now.
So what is global health?
Sorry?
What is global health?
That's a very interesting question, and it's something that it has been widely described, but there is not like a consensual definition. So global health is still not defined. Like there is not an agreed definition of what it is by scientists that study this. But I could tell you that there are two main ways to see what is global health. So the first one is it's international health. So most people see global health as public health and international level. So what is public health? Public health is a science of medicine that study the health of the population, right? So taking this, well, usually in a certain space, which is, it could be community-based, regional-based, or national-based, but not wider than national. So that's where public health stops. So then when you take it like out of one country, like cross borders, and you see public health as a cross-border issue, then it becomes global health / international health. So that could be one definition, to study, like, let's say, the health of the world population, the global population. But on the other side, there are some other scholars that describe global health as health as in total, to describe the determinants, what define what health outcomes will a population have. So it's not only addressing the health sector, but everything that involves or impacts on health. So here we address social determinants of health, you address social conditions, living conditions, poverty, so everything that goes around on the health of the population. So for me, it's both. For me, global health, it's both. So it's to see health as a whole, to identify what are the factors that are impacting on the health of the persons, of the people, but also to see how it is related with international relations, how diplomacy, international aspects, cross-border issues can affect the health of other populations. So for me, global health, it's both things. I think now there has been some intents to bring a consensual definition, which actually brings these kind of two concepts together. So that would be what global health is.
It sounds very multidisciplinary, lots of different professions, not just health professions, but social care, politics, etc. What's the role for doctors in global health?
So doctors and all healthcare professionals are the core of what global health is, because even though, as you said, this is a multidisciplinary approach to health, or a science with different multidisciplinary approach, at the end, healthcare workers are at the core, because we are responsible for prevention, early diagnostic, treatment, rehabilitation, and palliative care of the patient. So we help to the system to prevent diseases, to identify it early, to treat them, and then give all the necessary support afterwards, right? Not only doctors, but nurses, psychologists, nutrologists, etc., care workers, and so on. So that's why I see that healthcare professionals are in the core, because we have knowledge of what is the health issues, how does they come from, but we are also usually close to the communities, so we can help the system to approach the community, be the engagers, and make a change within the communities in order to change behaviors, promote healthy lifestyles, promote or decrease risk factors, and so on, and also help them to live with their diseases, right? So that would be the role. That would be like medical healthcare professionals that work in the clinical sphere. But we also can provide the system specialized advice on, or we can also be the decision makers on what should be done in order to tackle all of this. So that's also our role. We can not only engage at the community level, but we can also engage in policy and diplomacy in order to make evidence-based, quality-assured policies that can transform and can make an impact in reality in the society, and improve health outcomes and well-being. So that would be our role as deliverers, people that deliver services and help and reach out with the community, but also to change the system and design policies. As you said, it's not only healthcare professionals, but it's a wide range of disciplines that can participate on this. But I don't want to say this because I'm a doctor, but I think we are at the center of all of this. Well, at the center of the system should be the people who are the users of the system. But apart from that, I think healthcare workers are quite important.
What does a global health doctor do in a typical week?
So what I do, what a doctor in global health would do might differ because there are different ways on how can you approach global health. So you can specialize in economy and then do economical analysis. You can specialize in consultancy. You can become a decision maker and then work for the government and start doing like policies and take decisions. You can also work at NGOs. So you can work in academia and then lecture. So what I do, that's my personal experience. I work in global health, and I will add another word, which is diplomacy. So I work as a global health advisor, and I work in the diplomacy world. So what I do here in Geneva, usually in a common week, is to attend WHO member states information sessions where WHO deliver information to all the countries that are part of the organization, and they provide us useful information like updates, what is coming up. They brief us on a consultation that they are going to start, and so those are usually information session, and it's also a space where member states can ask questions to the secretariat. Then I could also attend member states consultations, which are processes that WHO holds with member states in order to gather information on a specific topic. So then for that, I receive instructions or feedback input from my Ministry of Health and Ministry of Foreign Affairs, or any ministry that is involved in the topic. And then we put this into a document or as a track changes document, and we send it to the secretariat, or we deliver some proposals, inputs orally in these meetings. So we discuss, and then sometimes we can negotiate also with the secretariat and within member states in order to create a document, an outcome document that will be presented to the governing bodies of the World Health Organization. Also, I could participate in member states only consultations, which, for example, for resolutions or decision-making documents that will be presented at governing bodies are usually presented by member states. So any member states can bring up, like, I want to propose a resolution on, for example, Mexico presented a decision on migrants and refugees action plan to renovate the mandate from WHO for the plan of action, sorry. And then we present the text, and then we negotiate it with other countries. So I participate there, providing input and bringing my country's position and make it reflect in the final document. So negotiate to countries for the best interest of my country. I could also attend meetings with stakeholders, like we meet with academia or NGOs, so they provide us input. And I need to be honest, I also participate like in social events. Like there are like networking events or like receptions that are held by X country for X topic, or like at dinners or lunches, which are usually working dinners or working lunches. So it's like a meeting just with food, and it's make it more interesting so everyone participates. And in the office, that's if I go out of the office, but in the office, I usually like prepare briefings for the ambassador, or prepare like talking points, prepare reports, send information to capital, receive information from my capital, and then send it to the secretariat. Like, it's a wide range of things that I do. So most of the time, or all of the time, what I'm doing is trying to translate my country's position into an action in the decision making of WHO. That would be like in one sentence, what would I do? But I wanted to explain so you have a better idea of what it is, of what I do.
What kind of a person is global health for?
So it's actually for everyone interested in health. Of course, I would say healthcare professional are the ones that should be working in global health. But literally, like if you study anything, you can be part of global health, because health has many aspects that no matter how where you working, there's usually a correlation with health. But I would say the major fields would be if you study politics, if you study international relations, if you study diplomacy, law or international law, of course, any healthcare profession, and yeah, that would be the major ones that are economy also, like health economy. It's quite big right now. So that would be the biggest ones, but literally any profession could fit in.
And what kind of skills or attitudes does a doctor need to be a good doctor in global health?
Well, skills. I think many skills relate to the medical profession, because you would have to have analytical. No, that's not the word. Critic analysis capacity. I don't know how to say it, but to be really good at analyzing the situation and come up with solution, which I think it's something that we are used in the practice in the clinic field. So I think that's something that is intrinsic to the health professions. So have a critical thinking. That's what I was looking for. Have the ability to read a lot and read quickly, and be able to summarize that in brief. Have the ability or the capacity to translate science literature into public literature or into policy, because that's what we usually do. Try to bring all the evidence it's out there and put it into a policy. That's something that there is a gap there, because in researchers should be able to try to do that for decision makers, but that's something that we could help on. So have the ability to translate clinical language into like general language. You have to have a sound knowledge of medical issues, which I think it's something that any healthcare professional would have, because even though these are more political or diplomatic negotiations, most of the time, of course, they have a technical background. So you will have to negotiate a political position, but it has to be informed on science most of the time, or it should be informed in science. So you also need to have the capacity to like have a good understanding of health care situation, and to do a good analysis of the data and information, the science that it's about this topic. Of course, you will have to have communication skills, negotiation skills, like both oral and written. You will have to be sensitized or to be able to work in a multicultural environment, because most of the time or all of the time you will not only work from people from the region, but from all countries, all backgrounds. So you will need to be able to adapt to this, and understanding, and be sensible and be respectful of other thinkings, other cultures, and try to put forward something that would be let's say acceptable. Sometimes you have to like move, but at the end that's something that you should be. And yeah, that would be like have leadership. That's really important. And yeah, that would be what I would say you need to work in this. It's quite general, but
is there one thing that makes global health really different to standard clinical practice? Can you pin it down to one thing that makes it different?
one thing is maybe the impact that you do in clinical practice. Everything you do would impact one specific person, one specific case, and in this you would impact thousands or millions of people. So that would be the main difference, let's say, between clinical practice and global health practice.
And why would a doctor go into global health?
That's really important, because right now I think not many doctors are looking forward to work in global health, or are not aware. Maybe there is a lot of interest, but not a lot of awareness of how to seek a career, a path in global health. So that's why more medical professionals, doctors, should work in this, because we are needed. There is a gap of healthcare professionals around the world, but of course in global health that's also seen. So we need more doctors at decision-making processes. We need doctors at global health in order to make a change and make policies that would be informed in science, and that would be more suitable for the reality in health that we would have. So that's what I would recommend to seek a career in global health. There are opportunities. I think also your lifestyle would be nice. That was one of my main criteria of why I decided to change clinical practice to global health, because at the end I realized I was, of course, everyone is interested in money, but that was not my main goal in life. So I think I have a good balance, work and my personal life. So that would be something that would be interesting, and that's something that would stay for years. Like global health will be there all the time. It's not like a specialty that sometimes could be like on trend and then another time not, and due to like health, life expectancy and health outcomes would change in the future. Global health will be like not the same, but will be there all the time.
I would agree that I think lots of doctors are interested in global health, but I suspect that they just don't know how to get started. So, if I think somebody who's just finished medical school, early on in career, who says, actually, I quite fancy a career in global health. And, you've said that the way you did it is you got started in societies and one thing led to another. But what tips would you give to an early career doctor who says, actually, I quite fancy a career in global health? How do they get going?
So I would recommend three things. The first one is, of course, as I did, to engage in these societies. IFMSA, it's in almost all countries, almost all regions. So I would recommend you to Google IFMSA and the name of your country and see if there is an organization at your country and at your school or your city, or reach out to the national organization so you can start participating. That's if you are a medical student. If you are a resident or you're an early career person, I would recommend you to look for the Junior Doctors Network, which is part of the World Medical Association. They are engaging in global health all the time. I see them, some of them are my friends. So that's another way. WMA is also, again, in almost all countries, and if not, just look for Junior Doctor Networks, WMA, and then they can help you to get involved in that. So that would be one path, the students or young professionals societies organization. The other way is to approach faculty members from your school, from your hospital that engage already in global health. That's quite easy. Look for the public health department, global health department, health policy department, whatever department you think might suit, and approach the people and just share with them your thoughts and start like reaching out to them and seek their guidance on what do they do, to see if you like it or not, and then to see how you can start a career in global health. Maybe there you can start a research project, or you can start doing something so you get familiarized with what global health is. And the third one it's the societies, it's the faculty members, and I just forgot the third one, but I would say to look at organizations that do global health, such as WHO, the UNAIDS, the Global Fund, and take a look at what they do, so you get familiarized of what is it, what is global health, how can you, if you are interested in the topics that would be in the agenda or that are addressed by these organizations, and that could help you out to understand if you really want a career in global health. and maybe reach out to the people that you see there in this organization and tell them, hey, there are usually like people wanting to mentor others. Usually in many schools, that's the situation, and you also look for mentor. But yeah, reach out to people that you see already in global health, and I would assure that many of them would be able to mentor you, even if it's like a 10 minutes conversation. I think everyone would be willing to do so. So those would be the three recommendations I would give.
What's the role of qualifications and master's degrees or formal training in public health?
So actually, there are careers in global health. There are some countries that have a bachelor's degree in global health. There are quite a few, so that's not something that would be available for everyone. But if you have it in your country and it's quality assured, you can take a look at the qualifications of the school. Then that would be my first to go place. If you're already a medical doctor and then you want to look for postgraduate, there are plenty of careers in plenty of masters and doctoral and postdoctoral degrees in global health. I just look for it. I ask friends about this. There are even like rankings of which are the best public health schools in the world. In my case, that's why I wanted to go to LSHTM, because it's the third in the world, the best in Europe. So that was my first choice. And also in LSE, even though you think it's economics and politics schools, it has its health policy department, which is incredibly good. Like I got in love with LSE for many reasons, but there are many others. There are also scholarships. Erasmus, if you know this program from Europe, it usually has a program on public health, and you can specialize in global health there. And there are scholarships for people from around the world, not only for Europeans. Then you have other scholarships like the one that I've got, which is the Achievement Scholarship, which is provided by the UK government in order to look for a master's degree in the UK, so you can contribute to the development of your country. That's a really good idea. They pay for everything. But there are also others in the US, like the Fulbright and many others. So there are different options. Just look for the ones that you think would be more suitable. Take a look at the program and see if that fits what you are looking for or what you want to get trained on. Based on what we have said, that global health is also quite broad, that you can get into like international sphere, diplomacy, policy making. What do you want to work in global health? Then look for a program that would give you the basis for what you want to do in your career. So also take a look at that, and that would be really helpful. That what helped me in decide which program, because in LSE and LSHTM, there are different programs. So the one that I choose was the one that fitted more my career path that I wanted to seek. So that's something that I would recommend also people to do.
Mm-hmm. Okay, so somebody gets involved in societies, national bodies, they get some mentoring them, they do a qualification, they've demonstrated an interest, they've now got a track record, they've done some projects. Who's going to give them a job? What are the employers?
So then it depends on what you want to work in. Of course, if you want to work on research or on academy, then go for a education institution, so you can seek a career in that. There are quite a lot of opportunities. Every time I see like postings in like the bigger schools, like again I said, LSE, LSHTM, observatories, and so on. So actually there is an opportunity there. If you want to be a decision maker, then maybe the path would be to start at the Ministry of Health at the country that you would like to work with. They're usually like health policy analysts, global health advisors. So there are different positions that you can start and seek a career in that sense, if that's what you want to do. Geneva would be a hub for global health. Here are plenty of options. You could work at the missions. You don't necessarily have the nationality of the country you would like to work in. You just would need to have to know the language of that country and know the background of that, so you can work with them. Most of the time, of course, they prefer national from their own country, but that's not all the case because you are not a diplomat, so you don't have to have a passport from that country. So you can do that. You can do internships in the missions. Not all of them are paid, but that's another way of getting into health diplomacy. International organizations would be the thing that most people would like to get into, but it's the most difficult one in my experience. But then there are also internships there. WHO now have a really good program of internships that I would recommend you to start looking for. You have to apply like 1 year in advance. So also take that into consideration. Usually missions, they have their own processes, but it's not that long. But for international organization, it would take you at least 6 months to 1 year to get into your internships. There are consultancy also in international organizations, and of course then like a position in international organizations. Another pathway would be if you want to do consultancy for government or academia or whatever. So there are plenty of consultancy agencies that you can work with. Most of them or all of them would have a health area. So you can start working as a consultant there. I have some friends that are doing that, and then they advise some countries. And that's another way to, like, if you want to like advise the government, but you don't want to work in the public sector or in the private, that's another way that you can do that, Lias. And of course, there is a private sector, and you can work as an advisor, or in the health department. That's not something that I love, but that's something that it's there. It's another opportunity. So yeah, there are many ways. And of course, NGOs, let's not forget about NGOs, not only like at the national, but the international level. There are plenty of NGOs like Doctors Without Borders, NCD Alliance, the World Heart Association, and so on and so on. So there are plenty of opportunities to work in global health.
I think what strikes me is that the career paths are very different to what people certainly in UK might be interested in, because in UK is you apply for a job, it's all national selection, you get onto a conveyor belt and you keep going, and then 8 years later or 6 years later or whatever, you come out the other end. Whereas what you've outlined is that there isn't one really well trodden path. There's lots and lots of different paths, and I'm also hearing that some of the jobs are the kind of jobs that you'll be competing with non-doctors for as well, because I'm guessing the analyst roles, yes, you might be a doctor doing that role, but you don't need to be a doctor. So I think for a lot of people that might be a bit off-putting and scary, because they don't know where they're going to end up with, or they don't necessarily have the job security. How do you and other doctors in global health handle that lack of one clear career path?
So it depends. For example, if you get into an international organization, although there is a little bit of instability because of the working conditions that happen to be in the international organization, you can follow a career within the organization and start growing. Also within the government, you don't necessarily need to be a politician and start you don't need to become a minister of health of your country. You can start you can be at the technical level, but start growing within the system. Also, as becoming a faculty member, maybe you start as a fellow and then you start growing until you get as professor or whatever you want to go. So in many institutions, there is growth that you can have a stability and look a path and be stable in somewhere, right? Actually, in the UK, it's also, I would say all the UK, but London, it's a hub for global health. There are plenty of opportunities there. Also within consultancy, you can start growing within that company. So I don't think, of course, you will have, there will be people from other sectors that will compete for the same jobs, but at the same time, you can also have stability if you find the correct institutions, I would say. But yeah, that's something that you could do. You don't necessarily have to be changing positions. Of course, if that's something that you would like, it's fine. But you don't necessarily need to do that. That's something I would do, for example. Yeah. I would like to have some experiences in some ways, and then let's say, oh, I enjoy this, I will do then this for the rest of my life. So now I'm in the mood like I want to experience different parts of global health in order to see what I would like to like do for the rest of my life. Let would say so. That's not something bad. Also, I think that's my perspective at this stage of my career.
Yeah, in fact, you're right, because the downside of the medical career conveyor belt is that you are very much constrained. It's difficult to do anything other than that. Whereas, what you've outlined is there's actually, there's lots more choice and lots more opportunities and lots more employers. So, that's scary, but also there are lots more opportunities. So what's the best bit of your job?
Oh, for me, the best bit is to be able to impact on many people, on many people, to make a change and improve the health of many people. That's the best part of my job, specific to be able to contribute to the Mexicans' health, although it might not be something that you would see immediately, because that's one of the how do you say it? Of the
Downsides.
cons, yeah, sorry, of the cons of global health, that you don't see impact immediately, but that's something that at the end would impact someone. So that would be the best bit of my the thing that I'm doing now.
And what's the most challenging bit of your job?
Hmm. I think to deal with I'm not sure if the correct word would be politics or it would be diplomacy, because we, as I said, we are always in a multicultural environment. So not all of the time the outcome that we have, it's the most appropriate based on science. Most of the time, the decisions that or the things that we come with are politicized, because it has to be like acceptable for everyone. So that's one of the most challenging things, to make everything that it's worth it, that it's evidence based, that it has a lot of quality, that it will have an impact, but that at the same time it would be implemented everywhere. Like it has the capacity to be like a general thing. So I think that would be the most challenging thing of my work now.
Mhm. And my final question, what would be your top tips for a doctor making career decisions?
Wow. So I would say I also struggle with making decisions, but I would first recommend you to talk with someone that is doing what you would like to do. That's something that helped me a lot in my career. I had meetings with people that were working on global health or public health, and asked them, how do they see global health? What would they recommend me? Like if they would advise me to work or not, if like what we are doing now. I had these conversations with people that were already doing this job, so that helped me a lot to have a better understanding on what would I expect in global health. At the same time, I was like hesitating of continuing my medical career or not, or then maybe introduce public health at a later stage. So that's when I realized I didn't want to continue with clinical practice, but move for this. So that helps a lot. Another tip would be to envision yourself in 10, 15, 20 years. How do you see yourself? What do you want to achieve? What lifestyle do you want to have? What are you aiming for in life? That also helped me, because then I realized, yeah, of course, it would be nice to be a plastic surgeon and then maybe have a lot of money, but the there is a lot of competence, a lot of like people now trying to do that, and I was like, it will be hard, and then it's life, it's not all about money, and that helped me to understand what I was looking for. I really wanted to have an impact at many people, not just at one. So that's why I also decided to go with global health. And then be critical about your capacities and abilities. because in my case, I also realized I didn't have that much surgical skills. I know most of them, you can like acquire them and practice, and there are like a lot of like tools now so that you can use in order to get those skills. But I was like really honest with myself. I really make an assessment of my capabilities, and I realized that I have more chances to be successful in global health than probably in a surgical career. So that's also another tip. So those three, like approach people that are doing what you do, think about what you want to do or how do you see yourself in many years, and then do a critical evaluation of your capacities. That would be my three topics for people trying to make this career decisions in medicine.
Wonderful. Thank you very much, Antonio.